The Food and Nutrition Services within the United States Department of Agriculture formulated a $2 million grant to allow allied professional organizations the development of a training program for school nutrition with a focus on food service. The main focus of our research is to explore the areas of 1. Meal preparation and service. The involvement of students in the meal preparation process will reduce the workload of personnel. Encompassing student work, children can develop a greater understanding of portions that consist of nutrient-dense foods, safety protocols, and sanitation. Within the school setting, the grant will provide a basic set of standardized sanitation for the School Nutrition Association and nutrition workers to clearly follow. Third, personal management and education. This will strengthen training models for food service personnel that will facilitate a comprehensive model with compatibility towards social barriers that hinder workers from obtaining continued education. Lastly, nutrition and meal management. The use of community engagement to secure new sources that could increase productivity for nutritional options. The school will vary on training, but will be umbrellaed by the National School Nutrition Association. The professionals consisting of this, but not limited to, food service directors, which as described as FSDs, this can consist of assistant directors and dietitians, food service manager, head cook, and lastly, food service employee. And this can be assistant, cashier, and a cook. And the second participants that would be involved in this grant are community members and family, as well as K-12 students.
As previously mentioned, this grant will include 4 subjects. First off is meal preparation and service. Second is sanitation and safety. Third is personal management. And fourth is nutrition and meal management. These subjects will be concentrated in public schools throughout the United States, as well as any professional organizations that allow nutritional professionals to gain membership. As for our local community, we discussed how the state of Oregon had professional standards intact for nutrition professionals. As for the funding of the grant, the funds will be directed towards the 4 subjects mentioned above. This grant is focused on all 3 stages. First is the pre-intervention stage. Here, we'll be focused on the current protocols that are in place in public schools in the United States. From there, during the intervention, we will implement personal interviews to measure confidence within the program. We will examine the knowledge of the employees by administering surveys to assess the program. During this time, we will also focus on the aspects that may hinder the educational delivery. Those aspects include personal, financial, environmental, and psychological methods. For the post-intervention, it would include a 6 and 12-month follow-up that would track the progress through evaluating the effectiveness and skills that have been developed throughout the intervention.
Food service directors have reported technology barriers related to convenience, applied knowledge, and interactivity, and lack of support within their workforces as major barriers to the implementation of updated nutritional standards. Evaluating current training models, providing applied training technology to personnel model, including minimum training hours and a credentialing process, and utilizing feedback from others in the workforce will improve cooperation and effectiveness between food service employers and their employees. The main focus of the program is to restructure this training. The availability of national programs, such as the Fresh Fruit and Vegetable Program, which provides produce to schools participating in the national school lunch program to facilitate the acquisition of nutritious food is a useful resource. Farm to Fork programs supports the development of sustainable logistics in line with an ecological model. Community advocacy will empower this network, and community partners will provide input to improve the connections and structure logistics in an efficient way. The goal of implementing new strategies for preparation and management is to increase student involvement in portioning and preparation of meals. A new approach to serving includes increasing the involvement of students in serving meals. This shift enables students to portion their own meals and avoid foods they won't eat, ideally reducing food waste and improving consumption. A recent study of the impact of involving students in meal preparation yielded an increase in the amount of vegetables and the amount of chicken consumed by students. These two innovations would empower students and reduce the workload of school nutrition professionals. Drafting safety and sanitation protocols based upon recommendations from the School Nutrition Association and guidelines put forth by the FDA and USDA, relying upon the principles of hazard analysis and critical control points, will solidify foundations of food safety. This will be achieved by adopting safety and handling checklists, evaluating the kitchen environment, and identifying best practices among the food workforce.
Why is nutrition training important for school officials and K-12 environments? The New Hampshire Department of Education recently released an all-encompassing statement which reads, "As a supporting effort to the school environment, school nutrition plays a significant role in bettering the health of students. The school nutrition program ensures that participating students receive foods that are based on nutritional standards, limits certain nutrients for sale, and provides nutrition materials and professional growth opportunities to school nutrition staff. The food service is often the lead in establishing systems to implement the federally required wellness school policies. As advocates who support families, ensuring that students participate in available nutrition programs is critically important to student growth and development. Food service directors need to be kept up to date with current nutrition standards and sanitation guidelines as they are released. This would include food handling, holding temperatures, and cross-contamination, food profiles, micro and macronutrients, vitamins and minerals, and recommended daily limits. They also need to be provided with and maintain an extended knowledge of allergies beyond the top 8, food derivatives, and the main preventative measures on airborne, ingested, and contact food allergies. Student performance and participation is shown to be enhanced by proper nutrition. Students are able to perform fully with full bellies by giving them access to nutrient-dense food options while at school. Students on free or reduced lunch programs may be receiving the bulk of their nutrition during school hours. In turn, the habits the students learn at school will translate into home life, allowing them to make the same healthy choices outside of the school environment. Our proposed program aims to increase overall nutrition knowledge among food service directors and associated school staff nationwide, establish a national protocol for food safety, meal management, nutrition management, and personnel management. We also aim to bridge the gap between school extracurricular activities, community involvement, and caregiver involvement across school districts. We plan to provide ongoing regular follow-up and teaching materials before, during, and after the course of the intervention. We would also like to increase communication between established food programs such as the school breakfast program, summer food service program, seamless summer option, after school meal and snack programs, the fresh fruit and vegetable program, and other community links.